Joining me now is Independent Senator Bernie Sanders of Vermont. First of all, Senator, great pleasure to have you on here. I know that the Republicans have started their assault on health care reform in the Senate today. Tell us about that. What is their plans and how do you plan on stopping it?
Frankly, I don't think they have the votes, but I think that it is a totally absurd proposal. They talk about our large deficit, and yet if they are successful in repealing health care, they're going to add $1 trillion to the national debt over a 10-year period. At a time when 50 million Americans have no health insurance right now, health care reform would provide health insurance to over 30 million. And what these guys want to do is say, no, we can't do that. At a time when people were denied access to health insurance because of the pre-existing conditions, they want to allow that obscenity to continue to exist. This bill, and I was active in that, would provide access to community health centers and double the number of community health centers for 20 million more Americans. They want to do away with that. Look, at the end of the day, let's be clear. The United States is the only nation in the industrialized world that does not provide health care to all of our people, and yet we end up spending almost twice as much as any other country. Is this health care reform bill the bill that I would have written? No, it is not. And one of the changes that I want to see is not to repeal the whole bill, but to give states the flexibility to go forward in more effective ways. In my state, I would like to see, and I think we've got a shot at passing a Medicare for All single-payer program, which in a cost-effective way could provide health care to all of our people. Those are the changes we need, not to wholesale repeal this legislation.
Senator Sanders, I want to talk a little bit about messaging, because whenever there's a decision that the Republicans don't like, they scream, they do a press conference, they say, oh my God, judicial activism. Why is there not a concerted effort on the Democratic side to do the same, honestly? Because you can't get any more judicially active than these two judges that overturned this law.
I think you're absolutely right on that. Look, this, to my mind, could we have written a better law, a stronger law, taken on the insurance companies more effectively, taken on the drug companies? Yes, we could have. But this debate took place for an entire year. Whole nation was involved in it. I'm on the committee. Trust me, we had hearing after hearing, markup after markup. And now it all comes down, perhaps, if you're correct, and you may well be, to one justice in the United States Supreme Court determining the future of health care in the United States of America. If that is not judicial activism, then I don't know what is.
Senator Sanders, how do you feel about the mandate? Because I know some progressives were not in favor of the mandate, including Howard Dean from your own state.
It is not the best way to go. The best way to go is to say, number one, everybody in America is going to have health care. And B, we are going to fund a Medicare for All single-payer program in an effective, in a progressive way. The problem with the individual mandate is in some cases it's going to be pretty regressive. If somebody doesn't have health insurance today, it may well be that they can't afford it. Government will help many people, but there may be some people who are stuck with the bill. And that's true. So I think there are more effective ways to pay for health care for all people than the individual mandate. Having said that, if somebody walks across the street today without any health insurance, gets hit by a truck, spends $100,000 in the hospital, you know who's paying for their bill? You are, and I am, and everybody else who has health insurance. Is that fair as well? So I think you can make the case for the individual mandate. It's probably not the best way to fund universal health care for all of our people.
All right, Senator Sanders, if the courts eventually struck down just the mandate but left the rest of the bill, might you actually be happy about that?
There is a debate about where we go from there, but I think the evidence that I have seen is that, in fact, you can deal with that reality. You can provide universal health care to all people without the individual mandate. But again, what I am fighting for right now is to give states flexibility to maintain the high standards in the health care reform bill, but give us the flexibility to do it in a more cost-effective way. I happen to believe that when you get rid of the insurance companies, when you put an emphasis on preventative health care, you can get rid of a lot of the bureaucracy and administrative costs that presently exist. You can provide health care to all people without having to spend more overall dollars.
All right, Senator Bernie Sanders from Vermont, thank you so much for joining us tonight. We really appreciate it.
Good to be with you, Cenk.